Hi everyone, my name is Jason. Can you hear me? I am ex-program director for Last Mile Health, now serving as the advisor, and I am very excited to share our story with you. And before I forget, I just wanted to thank Jennifer for inviting me, and also our CEO Raj for believing that I'm not going to make a fool of myself on stage today. So I actually want to start with a story. So this is Jerome, and Jerome is 4 years old, and he lives in a village called Waibo in a rural district about 10 miles away from the nearest clinic. So last September, he was actually very, very sick. So his mom, also in the picture, she found him lying on the floor, unconscious, unresponsive, and seizing from malaria that had gotten to his brain. And unfortunately for Jerome's mom, this was not an unfamiliar sight. She had given birth to 6 children, and only 3 were surviving. The other 3 had passed away before their second birthday from fever, diarrhea, and an unknown cause. So when she saw Jerome on the floor, she thought, okay, maybe this is it for my 4th child. So, I know what you're thinking, which is, why doesn't she just take him to the hospital and get treatment? And that was exactly my first thought too. So let's see what that would look like to get to the clinic. So this is a map, and 30 miles is a distance between the most remote village and the nearest clinic to it. Right? As you can see on this map, that's about halfway between New York City and New Haven. And per Google Map, that takes about 10.5 miles or 10.5 hours on a good day on a paved road. Right, so I don't know about you, but when I'm sick, I don't even want to get out of my bed and put on my pants. There's nothing I want to do, let alone walk 10.5 hours to get medication. So, I want you to imagine the last time you were sick. Maybe you had flu, you had migraine, maybe, whatever it is that made you really feel sick. And then let's imagine what it would take for Jerome's mom to take Jerome to the clinic. We'd have to walk through these narrow paths through rainforest, and there'll be mud, and then there'll be fallen trees that are blocking the road. And then you would have to cross log bridges like this with torrential rivers going under about 10 feet below. Imagine, taking an unconscious child, over this bridge. And some villages you can only get there by getting on a canoe like this. So, unfortunately, this problem of distance is not a new story, and this is not unique to Jerome's family, unfortunately. So in the district of Konobo where we work, the mean distance to clinic is about 18 miles. And that has had a devastating impact on the health of our people that we serve. So mean age at death is 29 years old. And 1 in 5 families lost a family member in the last year, and 1 in 20 families lost a young child in the last 365 days. So to me, this is, there's nothing that I can describe this other than, it's tragedy, and injustice. So this is a setting that we work in, and this is what we're trying to tackle. So what happened to Jerome? Fortunately, this time, Markson, who's our frontline health worker we've hired to work to provide health care in the community, have been working for about 3 months at this point. So Jerome's mom, this time, what she ended up doing was not going to traditional healer, who would not have done anything for Jerome really, was, she actually walked to our frontline health worker, his door, which was about 2 doors down, and knocked on the door and said, my child is sick, can you please come check him out? And he went there and correctly diagnosed that he was suffering from a severe malaria and gave him the right dose of treatment, and then walked him to the clinic about 4 hours away. So this is what we are trying to do. We believe at Last Mile Health that no one should die, certainly not Jerome, because you live too far away from a health facility. And the way we actually envision turning that into reality is by bringing healthcare to people's home, right in their homes. So how do we do that? So first we start where the patients are. So we start from their villages, and we work with the community leaders to identify high potential candidates. And we actually put them through a very rigorous screening process. And we train our frontline health workers on how to treat or diagnose and treat top killers in these rural areas, which are pneumonia, diarrhea, malaria for children, and pregnancy-related conditions and neonatal conditions. And after we train them, we send them back to the community, but we make sure when they're back, they have everything they need to be fantastic at their job. And we don't just stop there. So we make sure that they continue to improve on their knowledge and skills that they've been trained on by providing one-on-one mentoring at least 1 hour a week. And lastly, we recognize that the work that they're doing is actually very important, literally life-saving work, and that's hard. So we actually treat them like professionals, right? So we pay them living wage so they don't have to worry about, what am I going to eat tomorrow, right? So here I want to switch gears a little bit and tell you about the lessons that I learned as a program director about innovating on these last mile settings. And I want to do that by talking about cheeseburgers. Okay? This will make sense in 1 second, so just bear with me, right? So I, started working for Last Mile Health while I was at business school. And before that, I was at medical school where I spent a lot of time, learning about what is the best way to treat or diagnose a certain disease. And I learned that what's going to dictate, whether a patient lives or dies is what medication we choose or what diagnostic tests we choose. So, it was actually really great surprise to me when I got to business school that I learned that a lot of these very successful companies, they've gotten successful not necessarily because they had the best product or best service. They got there because they, figured out how to improve their production, or how to, cut costs in their supplies, or how to fund new ventures in a different way, and how to market, their services, etc. And this is where I get back to McDonald's. So when I was in Liberia, I actually thought a lot about McDonald's, partly because I was eating rice and beans for weeks, and I was just like, I want some, cheese and meat. And partly because I think, despite what may say about the linkage between fast food and childhood obesity in the US, I think we actually have a lot to learn from McDonald's. So quick show of hands, who here has ever had a cheeseburger from McDonald's? All right, a lot of you, right? Who here thinks it's the best burger they've ever tasted? No one, right? So isn't it surprising that we have, more successful fast food franchise in the world, but no one thinks it's the best hamburger in the world, right? And the reason why McDonald's has been successful is not because they try to make the best burger, it's because they try to become the best hamburger franchise, by creating this assembly line production system where high school students can even assemble a decent, not the best burger, consolidating their supply chains, and et cetera, ensuring high quality ingredients, et cetera, right? So if there's anything that you take away from my talk here is I want it to be this, which is that innovation or products and services in global health today by themselves they're necessary, but by themselves they are not sufficient to lead to impact, right? True innovation is all about, in global health today, is all about, how do you deliver those products and services, right? So what are some of those things, that we need to innovate? So you need to start with product and services. You need to deliver something. But once you have that, you need a delivery mechanism that can actually get those products and services to people who need them. And you need an organization on top of that that can meet everyday needs of that program. And at the end, if you want a large-scale impact, you need to grow and fund that. So, let's go through them one by one. So this is a takeaway that I got when I was working for Last Mile Health, or when I started working for Last Mile Health, is that high-impact products and services exist already. They already exist. And I would say there are conditions like, neglected tropical diseases or multi-drug resistant TB where we actually need better solutions. But for addressing conditions in rural areas where we serve, we have good enough products and services already. So let me give you an example of what that means. So last year, between 3 and 3.5 million children died in sub-Saharan Africa. Right? And 70% of those died from pneumonia, diarrhea, malaria, and preventable causes of neonatal death. And we actually have effective diagnostic tools and treatment options for those. And they can actually fit in a backpack of our frontline health workers. Our innovation is not that we are giving a fancy new antibiotics or using different diagnostic tools. We actually deliver these to our patients in a different way. So how do we do it? So when I think about delivery, I think the most important thing is make it as easy and automatic as possible for the end users, in this case, our patients. Right? At the end of the day, it's the end users or the patients, their experience that determines, the impact, but not just the technology itself. There has been a lot of, investment going into technology recently, which is good, but by itself, focusing on technology by itself is not going to solve the problems. It's thinking about technology in the context of how to deliver our services that's going to lead to impact. So let me give you an example. So about 5-10 years ago, this is how I used to go buy a book. I would get out of my bed, go outside, walk outside, and then drive to a Barnes & Noble's or whatever bookstore that does not exist anymore, and go buy a book. I pay cash, etc. Today, if I were to buy a book, I get out of bed, go on Amazon, and then just click this button. I don't even have to sign, or I don't even have to check out. It's so easy. It's so easy for me to buy anything on Amazon. It is actually unhealthy. Right? If I want to sign up for a new website, I don't actually have to sign up. All I have to do is click this button, log in with Facebook. If I want to go on Facebook, what I do is I just press F, and then it auto-populates acebook.com for me because it knows where I'm trying to go, and it actually takes less than half a second for me to go on Facebook. Because it's so urgent for me to go on Facebook and look at puppies, pictures of puppies and babies and, Jennifer Lawrence, like whatever it is, right? So, this is what I want for our patients in rural areas. Not the pictures of puppies and babies, but I want healthcare to be as easy as it is for me to go on Facebook, as automatic as it is for me to buy a book on Amazon. So what are some of the things that we do to make that happen? So we actually start with patients, but what we believe the way that we'll get to, make it as automatic and easy for patients is to make it as automatic and easy for our health workers to deliver that care, right? So we actually give our health workers database generated calendars and lists of patients so that they don't even have to think about who do I have to see tomorrow, because they already know. And when we first implemented this, our treatment numbers jumped by 30%. Another thing we do is we actually give them very easy to follow protocols. And when we do that, because we do that, our health workers actually correctly diagnose and treat sick children about 95% of the time. And we automatically restock our frontline health workers so they don't even have to worry about this. So we've never had a stock-out days. And what does that mean for our patients, though, right? Because that's the important thing. So what that means for our patients is this, is that, when a mother who has 5 children is too busy to go to clinic to get another shot of, Depo for family planning, she does not have to go walk for 5 hours, right? What happens is that our frontline health workers will know that she's due for another shot and walk to her house next door and say, do you want another shot? Do you have any side effects that I can, help, problem solve, etc. So it's automatic for them. And that also means for our sick children, they actually get diagnosed and treated early in their homes before they get too sick like to run. Right? And this is not easy to do, and I'll show you why. Maybe through this. Oh, all right. So this is actually a video, but it's a picture of our supervisors trying to go to one of our villages. And as you can see, it's muddy, and if the video were playing, what would happen is the motorbikes will be just growling, and it would not be going anywhere because this is an infrastructure problem that we are having. Right? So we actually have a lot of challenges because we chose to work in a very difficult to serve area, last mile. Right? So we have problems or challenges of road infrastructure. So some of the roads that we need to go on actually are submerged underwater for 3 months at a time. It's not always easy to find talented managers and clinicians really anywhere, but also at the same time, in rural areas, it's also very difficult. Supply chain is so rudimentary in where we work that an entire city, a rural city, can run out of eggs for a week, and you don't have eggs in market for a week, right? Yet, despite all of this, what we're trying to do is we're trying to provide consistent and sustained high impact, solutions. And that's where organizational innovation comes in, right? So what are some of the things that we are trying to do? So for example, for road, we are working with our partners, local partners who work on road improvement, building bridges. As you can imagine, if those motorbikes failed in the field, it'd be very devastating because patients just would not be able to get care because our frontline health workers, they don't get supervised, and they don't get their supplies. So what we did was we brought in a former Army Ranger logistician who used to maintain vehicles for military. So we learned from him, it's like, how do we actually maintain these vehicles so that they never fail in the field? And we're working with a group of experts around the world to figure out, how do we actually recruit, manage, and motivate our health workers and our managers as well. And to me, it's the innovation at this organizational level that led to success for companies like GE or Google. And one can say that it's probably harder for us to do this because we have so many infrastructural and external challenges that they probably don't have to deal with. Right? And this is why I think all of you should work on these issues, and it'll be awesome. So let me tell you where Last Mile Health is today. So Last Mile Health is serving about 30,000 people in District of Konobo. And our goal is by 2017, grow that number to 150,000 and work on 3-4 different districts. Right? As you can imagine, that will take a considerable amount of innovation in how we scale. Right? So that's the last thing that I want to talk about. As you may have heard, there was a talk by Dan Pelota, I think that's his name, about rethinking about charity. And in it, he said there are 45,000 for-profit companies that have exceeded $50 million revenue mark, whereas only 144 nonprofits. So as you can imagine, scaling and understanding how to scale in a social entrepreneurship setting, that is one of the biggest challenges that I have for Last Mile Health. And really the point of this is to say that if any of you have a great idea of how to raise $50 million in Last Mile Health, I have a person you need to talk to after this talk. Okay, it's me. So if you have any good ideas, please come talk. Lastly, what's important is that all of these things need to fit together. So program, product and organization. If you're designing a program that cannot be supported by the organization that you have built, then you're not going to be able to make that impact that you are trying to create. So I want to end with this note, which is, so just last week, we achieved 100% coverage for every single person living in the District of Konobo. And Madeline, who was our first frontline health worker manager and now is doing Rhodes Scholarship at Oxford, she wrote this beautiful note on that occasion. I just want to read it to you. So everyone told us attempting to provide access to healthcare in Konobo, the most remote area in Liberia, was a bad idea. They said it was too far, too difficult, too expensive, and too dangerous. In 2012, what had become a loud, voracious movement for the right to health for all Liberians made its boldest move yet, Konobo. And that move paid off. While illness has always been universal, today in Konobo, access to healthcare is too. So I want to end on this note, which is, I think perhaps the greatest source of innovation that we have is probably what Madeline articulated here, which is it's our ability to imagine the state of the world where people actually have access to care regardless of who you are or where you live. And also boldness to challenge those people who say it's impossible, it's too difficult, it's too dangerous. And lastly, courage to do whatever it takes to actually make that into reality, whether it's pushing up a motorbike along this log bridge. Thank you very much.